Welcome. My name is Natasha Sherman, and I am your host. And our show today is a roundtable discussion about transgender issues. So first I'd like to welcome Seth Rainess, who is a transgender educator, speaker, and coach.
Thank you.
Got that right. And Vanessa Gonzales, who is a transgender advocate, and Kerry Kay, who is the mother of a trans woman.
That's right.
Welcome. Thank you so much for being here.
Thank you. Thank you.
So I want this to be an educational experience. I want you to say all the things that you would have wanted to hear if you were watching this show. And I'm going to just start by asking a few questions of each of you.
Sure.
And so Seth, you are a transgender man who actually did the full transformation in the last few years, yes?
Correct.
And you work with young people particularly to deal with and to coach them into identifying early and taking steps early. Is that correct?
Correct, if that's what they intend to do.
Right.
I would like to be their advocate or their ally to help them transition early so that they can put that behind them and move on and try and live a normal life.
Right.
Whatever that means today. But
Yeah, and so what would be the most asked question of you?
well, I think people sometimes will ask me if I was scared. They'll ask me, how did I know? When did I know?
And the answer is?
I knew at a very early age. I think I was 8 or younger.
You said your aunt recently told you that she remembers you as an 8-year-old shaving and standing up to
It's
pee.
my cousin, right?
Or your
right.
cousin.
Yeah, exactly. She just told me that a couple of days ago. She said that, I remember you trying to pee at the urinal and shave when you were like 6 or 7 years old. So, so for me to tell her that she's only a year older than me, that I was transitioning, it was no big deal.
Right. And Vanessa, as a transgender advocate, what's your ultimate mission?
My ultimate mission is kind of like Seth's, is to kind of like debunk a lot of the myths, because in a lot of my trainings and my experiences, I enter a room and they already have a lot of preconceived notions already in their head and a line of questions that they already want to ask me or things about the training. So my job pretty much is to educate as well as debunk, because a lot of this educating is for folks to unlearn and relearn a lot of the things that they grew up with. Specifically with like religion or family, that's how these messages get into our heads. So my job and my kind of like my goal is to kind of challenge folks to make them realize that that these things are myths in their heads, and that you really have to understand that everybody's different and get to know them on an individual level in order to really learn.
Right. So do you think it's easier transitioning from male to female or the reverse?
I think it's easier to be transition to a trans man. I think but from my experiences and from where I live, it's similar because there's a sense of privilege because you're transitioning into privilege. You're transitioning to male privilege where you're allowed to occupy more space vocally, physically, and all these other things. And if you get misgendered, you're misgendered as like a butch woman, right? Which is seen as a little more accepted than a feminine man. Right.
I also think that, and this is one of the reasons I speak to kids, is I think, and we had discussed this earlier, is that if you can transition early as a man to female, you're not going to go through puberty because they can block it, and you're not going to carry a lot of male characteristics, which would absolutely, from a distance, already, coming towards someone would already make you look like you don't look like a natal or a born female. And I think that that's a very positive thing for kids when they're younger. I think they have a much better chance, and just like you said, they won't get cited as being like a butch female.
Right.
Yeah.
Kerry, as the mother of a trans woman, what's your reaction when Seth says the earlier the better, and how did that work for you or not work?
I like hearing that from Seth, and I wish it was true in the case of my daughter, who was identified male at birth and who didn't come out as transgender until just over 2 years ago.
And how old is she now?
She's now 25, in just a couple of weeks, in fact. If we had known back then, when she was a child, I think that life would have been a lot easier for her to this point. And I dare say that life would have been easier for our family in general, but particularly for her, of course.
Right, because as you and I had talked about, we did a show previously, there's a lot of confusion and a lot of interpreting the situation in ways that aren't accurate just because there's no information.
Yes, that's right. And, I can't know what my daughter's experience was. I can't know what, Vanessa's or Seth's experiences were, but I can only think that it's extraordinarily difficult for a person, while they're going through the process of discovering and uncovering, who they are, and then making the decision to show up as that person.
Right. And then as the parent, your biggest challenge was?
Oh, at which stage? Do you mean after Emma came out?
No, before Emma came out.
Trying to unthread exactly what was going on with my child there. My child had enormous difficulty in getting to school and being in school, staying in school, and then tremendous psychological difficulties and physical ailments that weren't quite diagnosable. We jumped through a lot of hoops, Emma's father and I, in discovering what was going on, and it wasn't until years later that we discovered.
That's the problem, because she's 25, so you have to look back 15 years or more. And today, everything is out there in every article or TV or internet, wherever you're going. But 15 years ago, you could get access to it, but it wasn't on the tip of your tongue, and it wasn't on 20/20, or it wasn't on 60 Minutes.
And 15 years is not a long time.
But it's a long for that.
Yes, exactly. But when you consider how much change has happened.
Yes.
So Kerry, so when she did transition, as a parent, I would assume that since you had been so invested in just trying to be a great parent and have her be happy, that it must have been a relief.
Well, at first it was a surprise. At first it was shocking. There was no indication whatsoever. My child, as a child, when young, presented as male. Did things that were considered to be male. But then I also think that in our family that perhaps we didn't allow for enough flexibility as far as gender expression was concerned. And then, when Emma came out as trans, the light bulb turned on, and suddenly it was like, that is what was going on all those years ago.
So there's this understanding, but also did you feel a sense of loss as well?
Oh, absolutely, absolutely. I think parents often spend time grieving for the loss of the child that they thought they had at that point.
Right.
But it's so much more helpful, I think, when we can turn that around, embrace our child's identity and, go forward and, kind of sign on for the adventure, because it has been, it has been an adventure.
Yeah, and I think also the grieving is normal.
Yes, it is.
Yes.
As long as you don't stay there forever. So now I want to pose the question, because we were talking about this before the show. The idea of most people confuse transgender with sexual preference when they're two separate and distinct things. So as a transgender male, it isn't necessarily so that you're going to be attracted to a female or a male. That's a separate issue. Am I correct?
That's sexual orientation, yes.
Yeah. So can you say a little bit about that, kind of to, educate people?
Well, gender identity is who you believe yourself to be, and it's established, and it's a known fact, it's established by the time you're 2 to 3 years old. Now, some children will actually say at that age, I'm not a boy, I'm a girl. They'll actually say it at that early age, and some kids may not say anything until they're 8 or they're 9, but it's established at that age. Your sexual orientation is who you're attracted to, and they're two different things, and that's usually around puberty. It's you like men or you like women. And a lot of times, people confuse them, and I think part and part it's because the term gender identity, not that it's old, it's new to the world. Most people grow up being a male or a female, and that's what they know themselves to be, unless you're transgender. And that's where gender identity comes in. And so it's a new term now for the world to get used to. And they have to understand that who you're attracted to is not who you think you are. They're two separate things.
Would you like to speak to that, Vanessa?
Definitely, and I think like what you're saying, like right, like the term gender identity and trans isn't something new, but it's new to the public consciousness. I feel like, and I feel like people are just starting to get the LGB in the acronym now, throwing in the T. People kind of throws a lot of people for a whirl. So I feel like having these conversations and like kind of sitting people down, just being like, who I am is separate from who I sleep with at night, right? And I feel like, because like who you are is in between your head, and who you have sex with is your own business, you know. But specifically, kind of what you were saying, like as a child, like I knew right away that I was a woman, and when I was growing up, I became very quiet because then people were telling me I was really a boy. Then I got quiet, but I knew who I was from a very young age. But then I knew who I was attracted to, like around like 7th, 8th grade. I kind of was figuring it out, you know. So I feel like folks really have to understand and also, like, I feel like there's a difficulty with this because gender identity and sexuality kind of expose the complexity of the person, and it kind of exposes the complexity of humans in general. And I feel like when a trans person enters a room, that talks against the norm, you know. And I feel like that kind of forces people to interrogate their own identities, and it kind of just throws their identities into their own faces in a way, because now they have to challenge themselves in order to think like, okay, there's a trans person, so what does this mean for me?
Yes, because I think it can be very confronting if a man is attracted to you and then finds out that you were born a male. And then
Male-bodied.
Male-bodied, okay. I got to get the terminology right. Yeah, male-bodied. So what do you do about that? And do you, where in the relationship do you have that discussion?
I think that's unique to each person.
Yeah, I feel like each situation's so different that it's hard to be like one umbrella answer.
Especially if you're in a situation where people are coming and it's a function that they know you're a transgender person, they already know it. But if you're going out just to go to a bar or a restaurant and you're by yourself and you should happen upon somebody that you like, you're having a conversation, you know, some people think I'm going to tell them right out, and some people say, let me see where this goes to a point that, you know, I need to tell you something if we're honest. Because if the person really cares about you, when you end up telling them that, usually it doesn't matter at that point, because they care about you as the person that they see and what's between your head and everything else. But you do, at some point you're going to have to tell somebody, because there's going to come a point where there's no hiding.
And I also think like the element of safety comes into it in a lot of ways, of whether you disclose your trans, specifically for like trans women of color, the homicide rate is 4 times the national average.
Yes.
Right, and like for me as a woman of color, but I pass as white, so I have a lot of privilege. Therefore, so I don't really have to think about those statistics, but my trans sisters do. And like I have a trans friend who she's from I think Senegal, and when she came to the U.S., she went to a club, and there was a guy talking to her, or whatever, and she was saying how the way they were reacting to me wouldn't be as if they were reacting to you, Vanessa, because yes, you're I'm Cuban and Iranian, so like yes, you're Middle Eastern and you're Latina, but you look white. You know, so the way they treat you is the way different they'll treat me. So I think also you have to think about like the idea of safety and like identity and how everything kind of intersects into like the moment. You know what I mean? So.
Wow. When I was going to direct this toward Kerry, but I'm going to just change. Seth, when do you feel most free and unencumbered?
The day I transitioned, you know, there was a huge weight that lifted off of me. There's this mental perseveration that just almost ceased to exist. I just felt like I didn't have to struggle to be in my body. I flowed into that very naturally, because obviously being older, my personality is what it is, and you're not going to change that. That's who you are. But it just seemed to fit. It matched what people saw. And so it made it much easier for me, because it wasn't like, oh, you're a girl. You know what I mean? I didn't get that anymore. You know, everything just flowed. You know, the way I talked, the way I acted, everything that I did just matched. And so you feel natural and you don't feel guarded. You feel at ease. I mean, we always look over our shoulder, but you feel at ease.
Yeah.
Vanessa, do you live, and I remember you and I had a discussion, and you said, you know, depending on, you're at Rutgers, depending on which campus you're on, and is there a time where you can feel unguarded, free?
A lot of times, actually. Since I came out, now the spaces that I enter, I am seen as trans, and I'm read as a woman, and I'm referred to as a woman. And just that in of itself is very freeing and liberating. And also, like, when I put on my makeup, and I get ready, and I go, and I just leave my apartment, that in of itself is a liberatory act, right? So right when I walk out the door, yes, I have to look over my shoulder a lot of times, or I have to be careful, or keep my head down, but at the end of the day, I'm so much happier, and I feel so liberated within myself.
I think we all, being sort of in the public, we are a little guarded, because you just never know where you're going and
or
the
who's
wrong
with
person
you.
in the wrong time, as opposed to someone who's living a stealth life.
Yeah.
You know, they're passing and they're just sort of going under the radar and nobody cares, whatever. But when, for the sake of good, when we're putting ourselves out there, we do have to be careful. I mean, it's not like I lose sleep over it, but you know, I certainly watch that somebody may not come after me because they know who I am because my face has been on this show or whatever it may be.
Yeah.
You know, and that's a little different.
Well, it's, you know, it's a very trite example, but it's like when I used to live in New York. When I go back into New York, I'm immediately in New York stance. You know, I'm watching things that I don't necessarily watch when I'm in Princeton.
Right.
Yeah.
Yeah. So, Kerry, do you think there's an age where, because, you know, looking back, you see what happened, what you knew, what you didn't know. Do you think that it's dangerous to let a child make that decision too young?
It's a difficult question for me. So I know that I have this seriously controlling side, and I think there's part of me that is nervous about letting a child, you know, make that decision. On the other hand, I am very aware that a child knows him or herself, you know, very well, very deeply. At times I think, you know, far more deeply than I ever could. And, you know, how could I really ever gauge the total inner life of my child? I've certainly met, you know, a few children who have been expressing from a young age that their gender is different to what they've been identified as. And I think that you know, care should be taken and attention should be paid to the child. I don't think that the parents should be ignoring the claims, the statements that the young children are making about their gender.
Right. And I think because of a lot of the publicity, the good publicity, I think parents go, oh, that's what my kid is. You know, because again, a lot of people don't know the terms and they're saying, now this makes sense. What I'm hearing you say and what I'm hearing from this person sounds like my child, and where can I go? And again, the internet helps a lot because they have, you know, a lot of resources out there as a first step. And as we had discussed earlier, you know, when a child's younger, if it's an issue of bioethics or when a child can make that decision, if they see fit, they put them on puberty blockers, which is a great thing in the sense of not allowing puberty to show through yet, because those are characteristics you can't undo if a child decides to transition.
So let's say you do put a child on puberty blockers. The impact is that it delays puberty?
Yes, that's what it does.
And does it have any negative connotations?
As far as I know, I mean, I was too old, they didn't do that with me, but as far as I know, and the people that I know personally that have their kids on it, so far there doesn't seem to be any. They do it for a lot of like children that are just developing too early in general, because of however the world is today. There's a time limit, I think it's about 2 years, I'm not exactly sure.
Like the
for how
optimum
long,
time, or how long you can do it?
Yeah, I think so, you know, but every doctor's different, I'm not a doctor. But it's great because then, you know, women don't get their period and men don't, you know, the testosterone doesn't kick in and they don't get male characteristics or muscles or a lot of hair or facial growth, which as a trans woman, facial growth is a big deal, trying to get rid of that. And then usually kids, by the time they're in puberty, or 13, 14, 15, even though they're not 18, they know already. They don't need to be 18 to make that decision. Kids at 13 and 14 really know, if they've started young and they're expressing it, that they don't want to be the person that their body is showing them to be.
So you don't think that's too early to
Personally, I
have
don't.
surgery or?
Well, now surgery's a different story. They can use the blockers for a while, and sometimes, you know, depending on whether it's male or female, they may have to go through certain things. I can't speak to you, but for female to male, you know, there's been this bioethical thing of, you know, top surgery or hysterectomies and things like that, but you can be on testosterone and not have a hysterectomy yet. They can sort of hold that back a little bit, but it helps. Everybody's different, and I think each doctor looks at the cases differently. I can't say that everybody at 13 or everybody at 16. It depends on the child and the therapist and the doctors and everybody that's involved. It's a whole group decision, but it leads to a lot, for male to female, it leads to a lot less surgery later on, and the same thing for female to male, because maybe their breasts don't develop, so they don't have to have breast surgery or, you know, top surgery. There's a lot of pros and cons to it, but more pros, I think, than cons to all of it. Because at the back end, you want the mental to match the physical.
Right.
And if you can stop a lot of the physical things that happen in puberty that causes sexual dysphoria, or, you know, not sexual, but just mental dysphoria, that's a big part of it as well.
Right. You know, it's interesting because I was having a conversation with someone who said that they thought it was negligent for parents to allow their children to make that decision that early. And yet, you know, as Kerry so eloquently described it, it's like trusting that they have their own wisdom. Like, it's not a passing phase. They're not playing at
But
something.
they're not making that decision early because there's therapists involved, there's doctors involved,
Right.
endocrinologists, GPs, you know. It's not the child. The child can express what they want, but there's a whole group of people. So when they say, you know, that the parents are letting them, that's not true, because you need the support of everybody else around. And for the mental, and this is where it's great that they're treating this child uniquely as this person, not en masse with everybody
Right.
else. You know, for this child, it's beneficial to do whatever.
Right. I wanted to ask you about each of you what, and I asked the two of you previously, but what would have been most significant for you to know along the way, or either not only to know, but to hear what help would you have needed that would have made it easier? I'll start with you, Kerry.
Ooh, I think it changes from time to time. But I've also had the realization that if we had known that our daughter was trans when she was much younger, I don't think that there would have been many resources available to us 15 years ago. And you know, things unfold as they do. But I think I would have liked to have had a trustworthy resource, wise one, whispering in my ear, "It's okay, it's
Right.
okay." But I would like to say, for parents in general whose kids are struggling with this issue, listen to your child, see your child, love your child, support your child, get
Yes.
information,
I
get
agree.
support for yourself.
Right. And what's the most asked question that you get as a parent?
It's usually questions related to transition itself, as far as, you know, physical changes to the body are made regarding hormones and surgery. And I find that that's a very personal area.
Right. It's actually one of the questions you shouldn't ask.
Yes.
Yeah.
It's like top
Yeah.
5.
Correct.
But it's always the first.
Yeah, it's always the first.
So why is it one of the questions you shouldn't ask?
Well, does someone come up to you
Do
and
you
ask you
ask?
about your personal life, and do you still have this and you still have that? People seem to think that what's between your legs characterizes who you are, and it really is what's between your ears.
Right.
Yeah.
So I understand that part. And what I was hearing, though, was when people have questions about the surgeries or the
That's different.
hormones,
That's different.
just like information gathering.
That's different if they're asking
Yeah.
you, where can I find out information
If they're
about
seeking out
this?
resources,
Or they're
that's
seeking out, but
different.
when they're saying to you, well, did you have the surgery yet?
Yeah.
You
Yeah,
know.
like for example, like if you were out like at the grocery store, would someone say, "Oh, can you prove you have a vagina?" You know what I mean? Like it sounds ridiculous,
Right,
right? And that's why you're
right.
laughing. But like, but it's as a trans person, it's my reality every day. You know, so it's like someone asking me, like, if someone's asking me, like what Seth said, like, where can I find resources for my friend or like my niece or whatever, absolutely, I will send you places. But if you're asking me what have I
Personally, your
done
personal.
yet, that's none of your business, that's my business.
Right.
I think that that's an important thing for you to say over and over again, because it's
Yeah.
a tricky subject, you know, so you're here discussing something that's very private, and then people don't know where the
Well,
stop line is.
There was a famous transgender male named Matt Cayley who unfortunately passed away a couple months ago, but he wrote a simple book that says the 10 questions that you should not ask, you know, transsexual people, and that's one of them. I mean, it goes along.
What are some of the others?
Oh my gosh!
Oh my
Tell me
goodness.
what,
on that
tell
one.
me
You
what
hear 'em all
you
the
don't
time.
want to be asked.
I don't want to be asked anything about genitalia. What was your birth name? That's a big question a lot of people ask. A lot of people ask that, and that's just something I don't want to talk about because then people will read me differently. Because then things are like, okay, so you were this before and now you're this. No, I was always Vanessa. I just didn't know I was Vanessa.
That's good.
For me, that's how I describe it for myself. Like I'm a woman of trans experience. Like I was identified male at birth, but I've always been a woman. So when I say, oh, I'm a trans woman, they're like, oh, so you used to be a boy, now you're becoming a girl. It's like, no. For me, the way I describe my story and my journey, I don't consider a transition. I consider it a journey. 'Cause I don't think it ever ends necessarily. Is that I've always been Vanessa. I just didn't know I was Vanessa until later in life.
It's hard for people to grasp because it's not concrete.
Yeah, because it's so personal.
Yeah, but you know
Very
what's
fluid.
interesting for me? As she articulates it, I get it, but I wouldn't have thought about it in those terms just by not being educated,
But-
because it, you know, again, when someone asks your birth name, like you say, it never would have occurred to me, like, wow, yes, it's very clear, I was always Vanessa,
Yeah.
you know?
But you know, why would you think about that? It's like,
Mm-hmm.
you know, we're enmeshed in that life, so this is, you know, we know everything that goes on with it, but your everyday run-of-the-mill person, unless they know someone or they have a reason to be connected to this particular type of thing, they're not going to know anything. It would
Yeah.
be
Right.
like, you know, finding out you have cancer. Okay, everybody has it, but now it's me. Now I know more about it than I
Yeah,
ever did,
yeah.
and everybody else has it, you know, because
Exactly.
they're buying a car. It's the same thing. Now I see all those cars on the road.
Yeah.
It's
Yeah.
the same thing.
And then,
Yeah.
like, in my trainings, like, a lot of people will ask questions, like, oh, what was your birthday, and things like that. And I just say, well, before I answer that, I want to ask you a question. Is that question for you, or is that question for me?
That's really good.
Are you asking the question so you want me to divulge
you?
into something very personal and sometimes can be very traumatic for me because you're curious about me?
Right.
You know what I mean? So kind
It's
of
really
understanding, kind of putting folks in that space to realize, like, wow, I'm answering just because I'm asking just because I'm curious, not because I need to know this, because it's none of my business.
It's really good. We're actually, it's hard to believe, at the end of our time. I really want to thank you. And I think it's so important for you to continue educating people from your experience, because otherwise we're kind of stumbling around not knowing, and it's really, you know, you can simplify it for us, really. And I think it's really great and powerful that you're doing what you do, each in your own way. So I want to thank you, Seth.
Thank you.
And Vanessa.
Thank you.
And Kerry, thank you so much for being willing to do the show and for
Thank
an
you.
honest conversation.
Thanks.
My name is Natasha Sherman. Thank you for joining us.